So this is how you put in a Foley catheter. You start by checking the order, of course, blah blah blah, do the whole shebang, and then you come into the room. Before you start the skill, you have to verbalize that you did pericare prior. Right? So explain the procedure to the patient. Patient wants a Foley, she loves it. So now you prepare your equipment. First you drape the patient. Get down. You don't have to drape it like this, but this is how you would drape it if you wanted to drape it. Put the sheet into it's a rectangular sheet, right? But you turn it to make a diamond shape. So you have one corner at the top, one corner in front, a corner on each side. And put the patient in a dorsal recumbent position. Bring one of these corners. Here's that corner. Put it over the patient's leg. And put it underneath the heel. Do the same with this corner. Put it over, not under. Okay. Over. Same with that. Under the heel. So now you have, when you expose the patient, at least the legs are covered. Okay. Covered for now. Right. And then you say again that you did pericare. Now you prepare your kit. You can use the package as your track there. You just put that right here. Okay. And you open your kit away from you, to the side, and then finally toward you. Now we will create our sterile field. Now it would be time to expose the patient. Lift only corner. Again, dull side is your sterile side. Shiny side will be facing down, so you can hold it like that. And you can put that there, over here, and then so that you won't cross your sterile field. And like that. And then just grab it at the corner here. Have the patient lift their butt and slide that underneath. Now you have your sterile field. Gloves are next. Pick up your gloves. You can glove right here. Got two left hands. Let's see if we can figure this out. Okay. And you can grab the fenestrated drape. Put it over. At this point, be careful about your gloved hand. You're sterile already. Try not to let it touch the patient's gown. So as you drop it, be careful not to put your hands over there. Alright. Now you repair your equipment. Open this. Pour it over your cotton balls. Also open your lubricant. Squeeze it in there. Wherever you want, here or over there. Then fluff your cotton balls. Make sure that you can separate them. Okay. Now grab and test your balloon. this point you don't really need your plastic anymore, so go ahead, get rid of it. But be careful so that your Foley doesn't flap around and get contaminated. Again, for our purpose, we will test the balloon. We follow agency policy, whether or not they require you to test the balloon. Okay. Hold this because it does come off. If you don't secure it, it will disconnect and then you'll lose some water. Okay, so we test the balloon. As soon as you're satisfied, just let it deflate on its own. Okay, try not to tug on it. Okay, you can give it a little tug, just no more than that. Alright, you can leave that attached. Now you're ready to go. You can position it like that. You can also position it like this. That way later, when you're done, you can still put this down here within the sterile field. Okay, now you have to spread the labia. And then clean again from the far labia. And try not to cross over here, because in case you drop this, it doesn't fall onto your sterile field. Okay, so just, okay, second one, near labia. And finally, center labia. If you have 6 there, you can do the whole process again. Okay. Do not let go of the labia at this point. If you let that go, your hand moves here, then you've contaminated the urethra. Now the urethral orifice. Now you have to start all over again. So now, again, be careful with the catheter. Don't let it touch linens or anything. So lubricate it and slowly insert until you see urine. Once you see urine in the tubing, go 2 inches more. Say 1, 2 inches. At this point, you can let the labia go now. Just hold the labia like that. The catheter, sorry. You can let go of the labia and hold the catheter here. It's okay to contaminate the catheter now because we're not going any further inside. Now you can bring this here just to secure it again so it doesn't come off, and then leave it pushed as you disconnect, and then there you go. Then you give it a little tug. As soon as your catheter is secure, now this hand is this glove is no longer sterile, so you can't be touching linens or sheets with this gloves. So you have to remove it. At this point, you really don't need to be sterile anymore. Put on a new pair of clean gloves. And then secure the catheter. You can get rid of this. You can tear this and secure the catheter. Now secure it right here. Okay. Make sure you have a piece of tape. You secure it right here. Leave this injection port open and accessible. Don't tape over it. Just tape right here. Do not tape over the inflation port either. Okay, leave it open and accessible. So secure it right here so that there is some slack for the catheter. And then put the bag over the leg, not underneath. Okay. And then secure it onto the bed frame. And then perform aftercare. Now removal. So this is here. Let's say this comes time to remove it now. You put on a new pair of clean gloves. Explain the procedure to the patient. Put the patient in the same position. Now you can put this is just a clean procedure, so no need to observe aseptic technique. Okay. You need to bring your 10 cc or 12 cc syringe. And then deflate the balloon just by connecting it. Let it deflate on its own. If it stops, then give it a gentle tug. Okay, give it a little tug, no more. Okay, and then instruct the patient to take a deep breath in and out. Just gently pull the catheter, and then put that into your gloved hand and cover it like that. This one, of course, would not be there. Then just perform, I forgot, you should perform pericare before removal. Okay, you should verbalize that you perform pericare again before